For many people, migraine means headache. So can migraine cause dizziness and brain fog without a headache? Hi, I'm Sam Maddock, osteopath and certified functional medicine practitioner. And in this video, I'm going to answer this question and also the steps you can take to start to address this. Many patients present to me in clinic without head pain, but with brain fog, dizziness, visual sensitivity, or feeling off balance. And they ask me, can this really be migraine? Well, before I answer that, it's important to always understand that new or unexplained symptoms do need to be investigated medically before we can proceed. But I see many patients in clinic who've had scans and tests and they've come back satisfactory or normal, and they're left wondering, well, what is occurring? Can this really be migraine? And what can I do next? Well, I explained to them that migraine is more than a headache. Migraine is a neurological condition that affects the entire nervous system. So it can generate symptoms such as brain fog, dizziness, visual sensitivity, or a sense of feeling off balance, even without headache. Because migraine is more than just pain. What we know from research is that the migraine brain is more sensitive and it struggles to put the brakes on sensory information coming in. That sensory information is coming in from lots of different directions, such as from our eyes, our inner ear, our upper neck, our gut, stress hormones, and many other signals. Our migraine brain is working hard to deal with this sensory information coming in. One way to describe this is if you imagine having a conversation with someone in a quiet cafe. It's quite easy to hear what they're saying and to concentrate on the conversation. If you take that same conversation to a crowded train station, things get much harder. There's lots more sensory information coming in. It's much harder work and it takes much more energy. Well, this is what it's like for a migraine brain. It's always working hard to deal with sensory information coming in. So if this is the case, the next question is, well, why do I not always get my symptoms? Because many people ask me this question and they say I can go days, weeks, or even months with no symptoms, and then suddenly my symptoms flare for no clear reason. Well, then I explain to them that because the migraine brain is sensitive and part of what we call a sensitive nervous system, then really the balance that we need to focus on is between load and tolerance. Load is the information coming in that's challenging your migraine brain and nervous system. And I describe that load in three main areas. We think about stress load coming from the nervous system and our body's ability to deal with stress. Inflammation load and the relationship between our gut, brain, and immune system. And mechanical load and the messages coming from our muscles, joints, and ligaments. And particularly in the case of migraine, we're thinking about the mechanical information coming from your upper neck. Then we balance that with your brain and nervous system's tolerance. What we mean by tolerance here is not just putting up with, but the ability to take on load, adapt, and remain stable. So if tolerance is high, it's much harder to trigger migraine symptoms, such as brain fog, visual sensitivity, sense of feeling off balance, or dizziness. But if tolerance starts to drop, then those symptoms can be easier to trigger. And you can just imagine the different ways that those symptoms may be triggered, such as disrupted sleep, the food you eat, stressful environment, changing environment. There's many different ways that the migraine brain can be triggered to produce symptoms, but it really relates to this balance of load versus tolerance. So if we want to take steps to start to address this, we need to think very much about this balance. And the SMH 3-step reset is designed very much with this in mind. Those 3 steps, safety first is the first step, is concerned with stress load and the ability of your body to regulate stress. Healing from within is very much concerned with the relationship between your gut, brain, and immune system, and how your body regulates inflammation. And freedom to move, which is concerned with the mechanical load and the messages from your muscles, joints, and ligaments, and as I mentioned earlier, particularly the role of the upper neck and the messages this is sending to your brain. And if we address these 3 areas in the right order, but that sequence is really important, and we can start to improve the body's ability to increase tolerance and deal with the load that's coming in, making migraine symptoms much harder to trigger. If this video resonates with you, I would encourage you to complete the SMH Migraine Scorecard. This is a simple way to understand your starting point. And the Migraine Scorecard is linked in the channel description and in the comments below. Because the best path forward is not chasing individual symptoms, but to start to understand the pattern that may underlie those symptoms.